Hello everyone, and a very warm welcome. Today, we are going to start with the absolute basics, the fundamental principles of pharmacology. Now, this is not just some chapter to mug up for your exams, mind you. This is the very language of medicine. Understanding this is how you'll understand everything else. So, let's begin.
So, what's on the menu for today? First, we'll get into the core principles of pharmacology itself. Then, we're going to solve that classic confusion: why does one drug have so many different names? After that, we'll see how a simple chemical becomes an actual medicine. And finally, we will track a drug's journey inside our body. Getting these 4 points clear is absolutely essential.
Okay, let's jump right in with our first section, the core principles. This is the foundation stone for everything that follows. It's all about the fascinating, complex conversation that happens between a drug and a living body.
So, what is pharmacology really? In the simplest words, it's the science of drugs. It's about what happens when an outsider, a chemical that we take, comes into our body and starts interacting with our own living system. Every single prescription you will write one day, every medicine you tell a patient to take, it all comes back to this one basic idea.
Now, this slide here is super important, so please pay close attention. Pharmacology basically has two main branches, just two: pharmacodynamics and pharmacokinetics. The easy way to remember this is dynamics is what the drug does to the body. Think of it as the drug's power. And kinetics is what the body does to the drug, how our body absorbs it, breaks it down, and throws it out. It's the drug's journey. So power versus journey. If you remember nothing else, please remember this.
All right, moving on. Let's tackle something that confuses everyone in the beginning: drug names. You'll see one medicine being called by 2, 3, even 4 different names, and you'll wonder, what is going on? Don't worry, it's actually very simple, and we'll clear it up right now. Look here, every drug basically has 3 types of names. Let's take propranolol. First, you have the chemical name. Look at that thing. It's a tongue twister. It describes the actual chemical structure, and it's for chemists, not for us. We can safely ignore it. Then, at the bottom, you have the proprietary or brand name. This is the catchy name the company gives it, like Ciplar or Indril. But the most important name for you as a future doctor is the one in the middle, the non-proprietary or generic name, propranolol. This is the official name, the same all over the world. This is the name you must always know.
And while we're on the topic, what even counts as a drug? Well, the World Health Organization gave a fantastic definition a long time ago. It's any substance used to, and listen to these words, modify or explore our body systems for our benefit. The key thing here is that it's not just about curing a disease. It can be for diagnosis, for prevention, even for research. It's a very broad and useful way to think about it.
So, we've talked about the theory. We've talked about the names. Now let's get a bit more practical. How does a chemical powder sitting in a lab become the actual tablet or syrup that a patient takes?
Let's start with the solid forms, which are the most common ones you'll see. You have tablets, which are really just compressed powder, but they can be quite clever with special coatings to protect them from stomach acid, for example. Then there are capsules, which are just little gelatin shells with the drug powder inside. Simple enough. Of course, you can have the drug as a powder itself. And then you have suppositories, which are designed for rectal use and melt at body temperature.
Now, what about liquids? Well, if the drug dissolves nicely in water, we call it an aqueous solution. If it doesn't dissolve, no problem. We can make a suspension, where the tiny drug particles are just floating in the liquid. Syrups and elixirs? Those are basically just solutions or suspensions with a lot of sugar or alcohol added to make them taste better. And then the really important one, injections. These are sterile liquids made to go directly into the body, completely skipping the digestive system. Remember that point.
And that idea of skipping the digestive system brings us perfectly to our final section for today: a drug's path inside. This is all about the different routes we can use to get a medicine from the outside to the inside, where it can finally do its job.
Okay, please look at this diagram very carefully, because it explains a huge concept. First, follow the path for an oral tablet. It goes from the stomach, into the portal vein, and directly to the liver. The liver acts like a processing factory, and it gets the first pass at the drug, breaking some of it down before it even reaches the rest of the body. This is called first-pass metabolism. Now trace the line for an intravenous injection. See that? It goes directly into the bloodstream. It completely bypasses that liver factory. This is why the route you choose makes a massive, massive difference.
So just swallowing a pill is convenient, but it has its downsides, right? The action is slow, so it's no good for emergencies. It can upset the stomach. The amount that gets absorbed can vary from person to person. And like we just saw, a big chunk of the drug can be destroyed by stomach acid or by that first pass effect in the liver. So with all these problems, how do we get around them?
Well, one very clever solution is the transdermal patch. You just stick it on the skin. The drug then gets absorbed slowly and steadily through the skin, right into the tiny blood vessels and then into the main circulation. The genius of this is that it completely avoids the stomach and, crucially, it bypasses that first-pass metabolism in the liver. It's a really elegant way to deliver a constant amount of drug over a long time.
Okay, let's end today with a quick clinical problem for you to think about. A small child is brought to you. They have a severe infection, a high fever, and they are continuously vomiting. You need to give them an antibiotic, and it needs to start working immediately. Based on everything we've just discussed, which route would you choose? And more importantly, why would you choose it? Thinking through problems like this is what pharmacology is all about.